Okay, welcome everyone to our CanSim webinar series. And today I'm going to share with you the launch of our new wound assessment and management virtual simulation games and virtual OSCEs. If anyone doesn't know me, I'm Marian Luctkar-Flude. I'm an associate professor from Queen's University School of Nursing, and I've been doing sim and virtual simulation for a long time now. Just to disclose, I am a co-president of the Canadian Alliance of Nurse Educators Using Simulation, and I'm an instructor for the Canadian Association of Schools of Nursing, the CAUSIN Canadian Simulation Nurse Educator Program. And in terms of funding, this project was funded by the Registered Nurses Foundation of Ontario, the RN-FU Nurse Innovator Award. So in this presentation, I'd like to take you through the educational module that we've developed, including the virtual simulations and virtual simulation OSCE that was designed to help enhance wound assessment and management skills of both nurses and nursing students. And in particular, highlight the differences with the virtual OSCE that we've created for the first time, and then share with you some results of the pilot evaluation of the module. So wounds are a universal problem or a universal challenge across all healthcare settings, and they affect persons of all ages, especially those that have complex chronic conditions like diabetes. They affect quality of life and are associated with increased healthcare resource utilization. And we know that early interventions can help prevent wounds from becoming more complicated. To adequately be able to evaluate wounds, nurses need appropriate education in the evidence-informed best practice of wound care, which includes the wounded etiology, types, risk factors, treatment options, etc. Unfortunately, there is a gap that we are trying to address with this module. Wound care is an entry to practice competency for registered nurses, and so it really is an important part of undergraduate nursing education. However, research suggests that nursing students and nurses feel that wound care education was inadequate to prepare them for the complexity of wounds in the practice setting. So nurses in all practice settings are challenged by the need to provide quality wound care. And it's complicated by the fact that there are so many different types of wounds, etiologies, risk factors, and treatment options. And additionally, each patient is unique and has particular needs that the nurse needs to consider. However, how can we expect nurses to provide quality wound care if they don't have ongoing access to evidence-informed resources to support their knowledge and their decision-making? And so we recognize that there was a need for effective educational strategies for nursing students, as well as ongoing education, professional development for practicing nurses. And so our solution or proposed solution was that we could use simulation and specifically virtual simulations as an alternate way to enhance delivery of wound care education and able to support nurses to provide best practices in wound care. And so I've been working in simulation a long time, and I know there's a lot of benefits to simulation in terms of application of knowledge, developing clinical decision-making and problem solving, improving confidence and self-efficacy, and then increasing competency in a safe and controlled learning environment. Virtual simulation games are similar, but they also encourage motivation, engagement, and preparation. And they are computerized simulations that are accessible from anywhere at any time, as long as you have a stable internet connection. And they support the repeatability of the simulation. Learners can repeat them as many times as they like. And then the interactivity is going to encourage engagement in the educational module. So our innovation was to develop an online educational toolkit that incorporates best practice guidelines for assessments and management of all types of wounds. And so what makes our module innovative is the use of virtual simulation games and the new virtual simulation objective structured clinical exam, or V-OSCE. And these allow nurses to both learn and then apply and test their knowledge and skills. And the module is hosted on a dedicated website that is part of the CanSim group of websites. So our work builds on several years of experience in developing and disseminating high quality simulation teaching and learning resources that aim to make learning both fun and accessible, as well as cost effective. And our dream team consisted of a unique partnership of passionate and creative individuals with simulation experience engaged with individuals with clinical expertise. So the team was led by myself and Dr. Jane Tyerman. We're both certified Canadian simulation nurse educators and co-presidents of CanSim. We were really privileged to work on this project with Dr. Kevin Wu. He's an internationally renowned wound care specialist from Queen's University in Kingston, Ontario, where I work. And he provided the clinical leadership for the virtual simulation content. We would also like to acknowledge the contributions of Dr. Deborah Tragano, who was also from Queen's University and is now retired, but her visionary leadership inspired the creation first of the Ontario Simulation Alliance, which eventually evolved into the Canadian Simulation, CanSim, let's just say CanSim. And as well, I'd like to acknowledge Dr. Barbara Wilson-Keats, who is an online learning and simulation specialist from Athabasca University, who started out at Queen's in the early days of simulation and worked with me there. And then I'd also like to acknowledge support we received from 2 CanSim members and research assistants, Monica LaRock and Laura Killam, who have supported the assembly of the virtual simulation games, the website development, and research activities associated with this project. And then I'd also like to acknowledge Marzia Motari and Idavania Costa, who shared their wound care expertise during development of some of the VSGs, and Nicole Shipton, who is an undergrad RA who also helped with this project and is currently working on a scoping review of the use of simulation to teach wound care in nursing education. And I forgot to add another person who was really important in this project is Michael Foley, who is a member of eLearnza, who supports our website development and was helping Jane yesterday to put the finishing touches on the website. So we use the CanSim VSG design process to create the virtual simulations and the virtual OSCEs. And some of you are already familiar with this process, but just to outline it, we start by creating the unique learning outcomes for the virtual simulations. And then we use those to create an assessment rubric that can be used by learners before and after they complete the virtual simulation to help them to self-assess their own competency related to each of the learning outcomes. And then based on these learning outcomes, we created 10 to 15 decision points along with rationale for each of the responses for the VSGs. From that, we go on to create the filming scripts, which include both the dialogue and the stage directions. And then we have those filming scripts peer reviewed prior to filming, and we like to have them reviewed by content experts as well as simulation experts to make sure we're not missing anything. The VSGs for this project were filmed in the simulation labs at Queen's University, and we used colleagues, family, and friends as actors, which helps to reduce the costs. And we assembled the VSGs using the CanSim VSG template, which is involves the Articulate Storyline software. We did some usability testing with some small group of undergraduate nursing students and instructors. And then I did a pilot evaluation in the fall of 2022 with a group of second-year nursing students at Queen's. So each of the 4 virtual simulation games that we created contained similar content, but they were specific to a different type of wound. And so the common content was related to risk factors, etiology, assessment, staging, cleansing, the dressings, patient teaching, and wound healing. And then they were specific to the 4 types of wounds that we covered. As I mentioned, we filmed these simulations at the Queen's University. We used a GoPro camera for the filming. As you can see, Kevin is wearing the GoPro camera on his forehead. So next I'll walk you through the components of the virtual simulation games for those of you that are not familiar with the CanSim format. So here we have our title page and our development team. The next pages are going to include an instruction slide on how the game works, as well as an accessibility statement about some of the accessibility features of our games. Then we have an entry form page where the student or the learner will type in their name, and then they will get a certificate of completion at the end of the simulation. So if you require it as part of their course and you want proof that they've completed the simulation, make sure that they do this and hand in the certificate. And then we always have the learning outcomes outlined on the slide. We can also incorporate the learning outcomes into a drop-down box. So if you look at the top here, you'll see a tab for learning outcomes. And if the student clicks on that at any point during the simulation, they will drop down and they can review them. And you can also add tabs here. So for the wound care simulations, we have included the measures assessment tool in all of the games so that learners can click on that at any point to remind them about the assessment tool. The next piece for each simulation would be a case history or a case summary that gives the background on the patient, why they're admitted, and a little bit of details about the wound without actually giving away the type of wound that the patient is experiencing. And we always like to start our simulations with a detailed report from another healthcare provider to mimic a good or role model a good report that the nurse would be expected to receive or to give on a patient with a wound. And then we would have a video clip that would proceed to a decision point. And this would be what the decision point would look like. What is the most appropriate primary dressing for this type of wound? And then, so it's a multiple choice question, and the learners must select the best of 3 responses to this clinical question. There is a rationale that will be provided for each response, whether it's correct or incorrect. And then the participants can select another option after they select the incorrect response. And then, of course, once they select the correct response or best response, the VSG will move forward to the next video clip or decision point. We also have the option to include NCLEX style alternate questions like select all that apply, drag and drop questions, in addition to the multiple choice type questions. So just to give you a brief introduction to the 4 virtual simulations, the first one is a pressure injury, and this is called Clara's Story. So it's an elderly female who had a previous CVA. She's in a wheelchair, history of type 2 diabetes. She's experienced some recent weight loss. She's on prednisone, and she's been having back pain for 2 weeks. And there is a dressing on her coccyx that requires assessment. So I'm just going to play a little video that will take you through the beginning part of Clara's story. Okay, so you can see Jane has typed her name in. The learning outcomes will pop up, the case history.
She's an 80-year-old female admitted with Falls. She lives with her
It worked earlier when I tested it.
sister. Mobility-wise, as she uses a wheelchair, so relatively immobile. Her past history includes a stroke with left side weakness 2 years ago, type 2 diabetes, and has been losing weight as of recently, at least 5 kilograms in the last month. She's on multiple medications, including prednisone, so we should look at her skin integrity. She has a dressing on her lower back that I haven't had the chance to assess yet. She also is complaining of pain in that area. I have completed most of her admission assessments, but still need to look under the dressing. Can you finish this assessment?
So now we have a question about the key risk factor for pressure injury. the drop down of the measures assessment tool.
Here are my pills.
Okay, thank you, Clara. Let's see. So you're on prednisone 5 milligrams.
Yes.
That was not the correct response. That was not the best response either.
Hey nurse, I've been laying here for a couple of hours. My back's really hurting. Can somebody help me?
And now we've selected the correct choice. So the game will proceed.
Is that okay if I call you Clara?
Yes.
Great. Just finished taking your blood pressure here. It's 90/72. Now, let me take a look at your lab. Looks like your hemoglobin is 90. Your white blood cell count is 17.2. Sodium is 135. Potassium 4.2. And your albumin is 5. And creatinine is 97. Now, I do have a couple more questions for you. Do you smoke, Clara?
Not now.
So when did you stop?
About 9 years ago.
Okay.
Okay, so that's all we'll show you for now. You can go on the website later and actually play all of the virtual simulation games. So the second simulation that we have is on the topic of a venous ulcer, venous leg ulcer, and we have a young gentleman, 35 years old, with a right lower leg wound who has a past DVT and also has a history of alcohol and IV drug use. The third simulation focuses on a gentleman with a diabetic foot ulcer. So Mr. Ted Williams, he's 64 years old. He's had type 2 diabetes. He's been admitted with an infection at the site of his insulin pump, but he also has a wound on his foot that the nurse needs to examine. And then finally, we have an infected surgical wound on a patient, Mr. Tesfa Abebe. He's a 35-year-old male who recently immigrated from Ethiopia. He's admitted post-op day 5 following a bowel resection and had a post-op ileus. And on this day, his abdominal wound has a slight dehiscence and some purulent drainage. So those were the 4 simulations, and we created those out of our design process that we've been using over and over for a number of years. We decided that we wanted to do the virtual OSCE so that we could test students. We thought it would be an authentic way to assess their knowledge and skill related to wound care. However, the design of the virtual OSCEs proved to be a little bit more complicated than originally anticipated. It was clear in my head, but getting it onto paper was a bit of a challenge. So basically, the virtual OSCE was going to involve 4 cases, so 4 subjects, 4 patients that were based on the same 4 wound care types as the 4 virtual simulations, because we wanted to test on that same type of content. But we needed to have new characters with new risk factors. So they were similar but different. And we created decision points for all of the components that were in the original simulations, but we needed to split them between the pre and the post virtual simulation OSCE so that there would be a balance between the question topics in the simulation. So for example, Reginald Winslow, we might use decision point 1, 3, 10, and 12 in virtual OSCE A and use all of the other decision points in virtual OSCE B. And the same for the 4. So we wanted to make sure we had 2 assessment questions in the pre and 2 in the post. And so I ended up making a matrix of all of the decision points, all of the patients, and then trying to figure out how to break them up throughout the virtual OSCE. The other thing that we did was we had Kevin, again, was the nurse in the main nurse in the simulations, working with another nurse. And so they were seeing each of these 4 patients together in each of the virtual OSCEs. And so we had to sort of repeat the introductions between both because they were new. Even though we filmed all of the decision points on one patient, we were only including half in each. So that was a little bit, and we had to be really careful with the writing the scripts, and then of course assembling the virtual simulation from that matrix. But those are the 4 patients that we came up with, and we couldn't use the articulate template that we had been using for the virtual games because they moved forward in a specific manner, and they had 3 decision points and 3 rationale, etc. So I'll show you what was the same and what was different between the virtual games and the virtual OSCEs. So for the multiple choice decision points, both of them had 3 possible responses, and one of them was correct. With the virtual simulation games, it would move forward once the correct response was selected. But with the OSCE, because it was a test, we weren't giving them the opportunity to go back and correct themselves if they selected the wrong response. So if they selected this wrong response, they would get a message that their response had been submitted, but they weren't being told immediately that it was correct or incorrect. And what would happen was their response was submitted, and then we would have a new video pop up. And Kevin wanted to provide some feedback on what the actual correct response was in the video. So he did do some teaching within the virtual OSCE, which was a nice touch. And so they did get some feedback, but it wasn't the way it was provided in the virtual simulation games in a pop-up box. So the alternative type questions were used for both the OSCEs and the games. And then for the grading portion, the virtual simulation games, the learners simply get a certificate of completion. And the reason for that is that we actually encourage students to explore the wrong responses to see what those consequences are, and to read the rationale to give them better understanding of what is correct and what is incorrect. But for the virtual OSCE, because we wanted to have a score, we did calculate a quiz score, and we have managed to put it on the same page as their name will pop up. So now if you had students do these pre and post, you could have them print off or not print off, but save the page with their score and submit that as proof of doing the OSCE or the quiz, and as well as their score, if you wanted to record that score as part of a mark. But again, that's up to you, but it does give the students some feedback in terms of, oh, my pre-score was 5 out of 10 and my post score was 10 out of 10, or whatever it may be. So it is part of their learning to do the quiz. And now the highlight is that we have hosted the VSGs and the V-OSCEs on the Wound Assessment and Management website at www.woundnursing.ca. And so this website is now live, and hopefully we've got all the glitches out. And if you notice a problem, please let us know, and we'll get that fixed as soon as possible. And I'm just going to share that the online module or toolkit is open access, and the V-OSCEs and virtual simulation games are packaged together as a course similar to the SOGI nursing module. And the website also hosts a variety of evidence-based resources about wound care that can be accessed directly from our website. So next, I'd like to introduce my colleague, Dr. Jane Tyerman, who is going to take us through the new website and the Wound Assessment and Management course. So Jane, if you want to pop on, and I will stop sharing so that you can share the website.
Great. All right. So as Marian said, here is our website. We have formatted it in a way that is easy for educators to access the virtual simulations, both online, and they are SCORM downloadable. So we talk a little bit here about wound care and why it's important that we provide more education to nurses in practice and nursing students. It talks about our work with the RN-FU Nurse Innovator Foundation, our fund. We have a little bit about our project and our team. So it talks about the current literature that's out there. It highlights certain games that we have within this educational toolkit. If you click on the simulations, this is where you can access the virtual simulations. We talk here on the right-hand side, gives you a brief overview of each of the games plus the OSCE, the pre and post. If you want to access it as a web-based resource, so you can link students to this, or it is downloadable in SCORM. And what that means is you can download the full package with the pre-quiz, each of the virtual simulations, and the post-quiz. And you can download it in a way that is completely embedded into your own learning management system. This often takes a little bit of technology savvy. So if you have an IT team that can support, that's great. But otherwise, you can directly link the students to the web-based access. We are collecting a little bit of analytics because we want to know who is really using these virtual simulations so we can really target the needs of those learners. So I'm going to put it here as I'm a professional. I'm here because you want to use it for further information. And it's important to know that we are not sharing any of this analytic information with anyone but ourselves. It's just to increase the reach and the applicability of our resources. And anything with a star has to be finished. Like you need to put something in there. So if you continue there, you have the wound assessment and management. It tells a little bit about the course. You can access things individually here, or you can use it as a full course. So I'm going to start it as the full course. And basically what it does is it navigates you through each of the sessions. So we've highlighted this, that we really want you to use this self-assessment rubric. So these are downloadable either in a Word document or a PDF. And the reason why we've done it both in a Word document or a PDF is the Word document, the students can then write information. They rank their perceived competency to meet each of the learning outcomes, and each of the learning outcomes for each virtual simulation is the same. So it's standardized. So we encourage them to complete it pre-toolkit and then post to identify where they have extended their learning and where areas that they want to continue focusing on with other resources. So you can have them upload this as proof that they've completed it. At the end of each virtual simulation, they will also have a certificate of completion that they can print off and also upload into your learning management system if you are assigning these for marks or as a required, like a pass-fail. Next is the pre-quiz. So this is set up for all virtual simulations. They can either complete it right online, or if they want to have a full screen access, they click this button. I want to make sure you guys can see the same thing, but there is the full screen where they can navigate through. And this is important for people that are visually impaired. All of our virtual simulation products are compliant for accessibility and disability. So after they complete that, we continue into the first virtual simulation. So as Marian discussed, this is Clara's story. We talk about the learning outcomes and then the virtual simulation, either here or in full screen. Then we go to Adam's story with the learning outcomes and then access to the virtual simulation. Ted's story. I guess I don't need to show you all the way through, but I'm almost finished. I just have one more, Tesfa. I'll get you through that one. And then we take you to the wound assessment and management post quiz, or the OSCE, as Marian discussed. And the debriefing options. So at the end of this toolkit, it is really important that learners have the opportunity to debrief. And this is different ways of debriefing. We provide the embedded feedback. The self-debrief is the self-assessment learning self-assessment rubric. You can do an in-person, synchronous, and asynchronous. And for the asynchronous, we also give you some reflective questions that the students can complete on their own. They can put it into a discussion board. They can answer them as an assignment if you're using it in your course, or for people that are practicing, they can just take some time to contemplate each of those. Once they're finished that, they have completed the course, and they can now move on to other areas in on the website. So we have different options. So I'm just going to go back to wound nursing. And so there are other resources available here for you. There's wound care resources that we have listed, and they are searchable. We also have academic resources, and they're all categorized under clinical improvements, nursing knowledge, continuing education, pressure, injuries, and ulcers, which has had a huge focus of research and wound in undergraduate education. So we do have these resources, and we are updating them all the time. Then if you would like to contact us, if you have any other ideas for potential wound care resources, publications, or topics for virtual simulations, you can contact us here and we will get back to you. So that is our wound care toolkit. We hope you find it useful and that you can use it within your program or to advance your own knowledge.
Thanks, Jean. It looks great. Okay. You can see my screen, right?
Yes.
Okay. Okay, so finally, I'd like to share results of the pilot evaluation of the virtual simulation games and virtual OSCEs that I conducted at Queen's University this past fall. So it was a pilot evaluation, and I was teaching the medical surgical nursing course to second-year students. And so I evaluated the module in my class following a lecture on wound care. And so I used a pre-test, post-test design. And you can see in the flow chart here, the activities that learners completed pre-sim, during sim, and post-sim. So they had the lecture and some assigned readings. There was the pre-quiz, or the virtual OSCE. And I just want to point out that we've been calling it virtual OSCE all along, but I've had some feedback that OSCEs make students very anxious, which is very true. And so that's why I've changed the name on the website and in all of my materials in my course to call it a pre-quiz, so that it makes it sound a little less scary, hopefully. And so they did the pre-quiz and they did the pre-self-assessment rubric, and they had to submit the proof to me that they had completed those. Then they had to complete the 4 simulations and again submit the proof that they had completed each of them. And then for post-sim, there was the post-self-assessment rubric and reflective questions that I did ask them to upload. And then they completed the post-quiz and a study survey. I wanted to counterbalance to account for any differences between the difficulty of the 2 virtual OSCEs, because I sort of randomly assigned decision points to one or the other. And so I divided the class. I don't know if it was A to L did virtual OSCE A first, and the other half of the class did virtual OSCE B first. And then when they did their post quiz, they were asked to do the opposite. And so that gave us a nice balance of participants doing each of the OSCEs first or last. And then the outcome measures that I used in the study were knowledge from the virtual OSCE, so the score that was submitted. They also completed the self-assessment rubrics, and so that was their perceived competence. And for satisfaction, I included the CRISP scale, which is the Classroom Instructional Perception Scale for virtual simulations. And it has 3 subscales: usability, engagement, and learning. And so they completed that on the survey. So this is a table that shows the participants. We had 183 students in the class that completed the wound assessment and management module in the course, and 79 students provided assessment components for the study. The participants included 56 students from the 4-year stream and 23 students from the 2-year accelerated track. You can see they were mostly female, and that they had little experience playing video games, but most of them had some experience completing a virtual simulation in the past. So these are the results from the virtual simulation quiz, or the OSCE, and it showed that the learner knowledge increased significantly from pre-test to post-test, regardless of which of the OSCE versions they completed first. However, it was noted that the version B appeared to be more difficult. So the mean score for those that completed OSCE B first was much lower than those that completed V-OSCE A first. And then the scores were more similar post, which was nice to see. So based on that, I've chosen to use version A as the pre-test and version B as the post-test. There was also some qualitative feedback that we incorporated into some changes in the OSCEs before we posted them on the website. And I think those changes will make the two OSCEs more equal, but we'll be testing that in our future evaluation. Table 3 is from the assessment rubrics, and we can see that the learner perceived competence also increased significantly for all 4 of the learning outcomes associated with the module. So that was good to see as well. On the CRISP survey, the virtual simulation games were rated significantly higher than the virtual OSCEs in terms of the usability scale. And they also rated the VSGs higher in terms of engagement and contributing to learning, but the differences were not significant. And I think the reason the usability for the OSCEs was rated lower was because of a feature that we've added that I will talk about shortly. So there was some qualitative survey feedback that was elicited. And so from that, there were 3 overarching themes in terms of benefits. So those were emotions, learning outcomes, and then transfer to practice. And so the feedback was overwhelmingly positive in terms of the virtual simulations contributing to psychological safety, knowledge, and confidence. And they felt they would be able to transfer this knowledge to practice. The only challenge that was identified was that they wanted to be able to go back and see the wound again before they answered questions about the wound appearance and exudate, which makes a lot of sense. And so that's what we were able to add. We added a button so that when the question popped up, there's a button that could say, review the wound. And so they would click the button, then a photo of the wound would pop up. They could look at it again before they answered the question. And so also, based on responses to the reflective questions, which was not part of the study, it was really clear to me how there was a cumulative effect and benefit of completing the 4 VSGs, because there were comments like my confidence increased from one to the next, et cetera. And also from the 2 virtual OSCEs as well. And they really valued the visualizations of being able to that we were talking about, and then the role modeling of the best practices and also the patient teaching that was done in the simulations. So what are our next steps? Well, we invite you to use the wound assessment and management module in your own course. As I said, it is completely open access. And for those of you that are interested, we invite you to participate in a multi-site evaluation that we will be conducting in the fall of 2023. And if you're interested, we suggest you join the CanSim Research Interest Group for more information, because this is being run through that group. And we just happen to have a meeting tomorrow evening at 7:30, but you must register in advance. And so you can go to the CanSim website if you're looking for information on that. So that's all about the new website and the simulations and the OSCEs, and we're really excited to share those with you. Finally, we've been promising and teasing you about them for a while now. And so we'd like to open the floor up for questions. Are there any questions? Well, there's some references, contact information.
So there is something in the chat. So Lorena Bonet says, excellent presentation, lots of hard work. Thank you very much for sharing and making it available to people.
You're very welcome. And thank you to RNFU for funding us.
I just have to say, I would also, I'm just going to chime in. I think that they were really well done. I did try one of the games. I think the vascular leg exercise, not the OSCE, because I wasn't, but I'm looking forward to trying that. I will say I was very intrigued as to how you made the wounds so lifelike. I was really very impressed by them. So even the exudate, like that was something, and to be able to look at it, you know, it was really well done. Really well done. Yeah, good work for sure.
We experimented with lots of products to make those, like we purchased some wounds. I couldn't buy an open wound, so we bought a set of 3. They were actually supposed to be cesarean wounds, and we bought 3 in a pale skin color and 3 in a dark skin color. And I put my own staples in them, and then we opened them up where we wanted them open and threw all kinds of goop on them. And yeah, so.
And one of the things, if you are going to do your own, you saw that we didn't put them on mannequins. Most of the wounds are set to stick to a mannequin's plastic body. And obviously our skin is very different. So Medicor Lab was one company that has now been taken over by, who is it, Marian?
CAE.
CAE, yes. And so they have a product that is more sticky, but we still had some difficulties. So the first one, the pressure ulcer on Clara, it was on her coccyx area. And so we did have a hard time, and you want to moulage it so that it looks like it's the same skin. So that was a little bit of a challenge, and we tried 2-sided tape and a whole bunch of different things. So that is one thing to consider if you're using real patients or the mannequins. And wounds can be very expensive. So look around, they're varying prices, and see if you can get different skin tones, because the assessment of brown and black skin is also really important. So those are a couple of things that we found. And also when we were creating them, we also thought, you know, how important is it to have this wound on a live actor's coccyx while filming? So at one point we did a hybrid simulation and then moved it over to a mannequin so that we could have those, you know, safety for the actress.
I see there's some questions in the chat. Sherry's asking, did you give students marks for doing the VSG in the course? So I actually did. Earlier in the course, I had them do a VSG on smoking cessation, and I did not give them a mark for that one. But this one was more complicated because there were 4 simulations. There were the 2 OSCEs, and I was asking them to submit, you know, all of these documents to prove they had done everything. So I actually gave them 5%, and I don't usually do that, but it was a lot of work, and so I did. And I really based, I stressed that I was basing the mark on the reflective questions, and that if they would get 5 if they showed some, if they demonstrated that they had been thoughtful about responding. And I was impressed with the responses that they gave on the reflective questions, and they really did think about their learning and how they were going to transfer that to practice. So that was really nice to see.
And it's really important too to assign some sort of grade to it, because if you don't, the students don't do it or take it as seriously. So when I do it, we had to have a meeting within our faculty about awarding marks for virtual simulations, and it was as agreed as a faculty where we were either doing 0.5 or 1 per virtual simulation. And we didn't use it for, I didn't take participation or anything like that, and be very clear, are you doing it for, do you have to get a certain score on your post OSCE? So be very clear to them when you're done, or is it just completing it and uploading your certificates?
Yeah, so I didn't count the score that they got. I wanted to know what it was because I wanted to see if they improved or not, and I wanted them to see if they had improved or not. And I see that Roseanne was really interested in the use of VSG for OSCE, trying to get buy-in for developing VSGs in New Zealand. So yeah, so this is the first time we've tried a virtual OSCE. And I think what made it complicated was that we had the 4 different cases because we were creating an OSCE for the package and not just for the individual simulation. So it would probably be easier to create 4 short quizzes instead of the more complicated one. So that might be something we would consider doing in the future. Yeah, so students don't do work if there's no mark. Yeah, that's the problem. But I also told them that this is going to help you study for your, for your midterm and your exams, because this content will be testable, right? So. And maybe, maybe in the future we can, standardize our V-OSCE process and actually use them for marks. The problem, of course, is protecting them so that students don't get access to them. And I struggled with actually putting them on the website, and I decided, because we hadn't validated the V-OSCEs to a degree that I was happy with, that I would put it up there and people could use them for self-assessment purposes for the quiz. So, and for research. So hopefully when they do research, I asked them not to look at their notes when they were answering the questions. And of course I told them that there was no mark for the quiz. I just wanted to see what they did.
But what was something that was really interesting to both Marian and I is that when we proposed the V-OSCE, the amount of kind of, I don't want to say pushback, but the fear of using that word OSCE. And so that's why we did call them the pre-quiz and the post-quiz. So, the term OSCE means, there is like, do they pass it or do they fail it? So just an interesting conversation that we had.
Yeah. So I was calling them, for a while, I was calling them virtual simulation quizzes, VSQs. But I thought it was just clearer just to call it a pre-quiz and a post-quiz. And but in my mind, it's a virtual OSCE. So. Are there any other questions? So I'll turn off. So we do hope to develop some more. We originally had a plan to do like 10 different types of moons with Kevin. We do need some more money to support that, and some new actors and new and everything. So we will hopefully have a few more out in the coming years as well. Okay, well, I think I will stop the recording.